In terms of benefits for the radiologist, I think one of the big things that I try to do is be efficient, right? We want to be efficient. We want to work through, our screening mammograms as efficiently as we can. And if I know clearly that there's an area that is marked by the technologist that's a scar and it's communicated to me in a clear fashion, that makes it much easier for me to streamline my process. I work at different facilities. And again, if there are different protocols, it becomes very challenging to think about, where am I reading today? Are they marking the scar? Are they not marking the scar? Which markers are they using? Are they going to communicate that? Am I going to see that on their intake form or their medical record? So anything that keeps me consistent and keeps a streamlined protocol, I think, is very important. Also correlating, being able to then look at a marker and know exactly what it correlates to, as there are different shape markers for different purposes. We don't want an unnecessary recalls also. We want to obviously, make sure we're recalling things that are significant and that really need to be recalled. Also the delays in getting other patients in who maybe really do have a problem. And we don't want to delay those patients as opposed to unnecessary recalls for something that could have been marked and eliminated this potential problem. And also it's just the permanent documentation, so that again, if a patient does decide to move to a different state, they know clearly that what we've marked is a scar marker or something perhaps in the skin. Just being very clear so that it makes it easier for another radiologist to understand and know exactly what we are talking about.